Assalamualaikum and good morning. Today we are going to present about a study of factors contributing towards good public management on standard operating procedures during the pandemic of COVID-19 in Klang, Selangor. My name is Muhammad Izzul Hakim bin Zulkiflee.
Hi, my name is Alya Shahrizal. As for the research background, the term public management itself refers to a set of well-defined processes and management relationship that exists between the part of the administrative system through which laws are passed or services delivered to the public interest, including planned, organized, and coordinated. In public management, of course, there is a policy making involved because they are the one who made the policy that we all have to follow now. Every organization come up with their own policy, especially that must be obeyed by their work. Policies are the administrative activities taken by the government, such as laws, rules, decisions, or directives. The purpose of this study is to examine the factors that contributed towards a good public management on standard operating procedures during the pandemic of COVID-19, specifically in Klang.
Next is the problem statement for this study. In early 2020, the world was shocked by the spread of coronavirus disease COVID-19. The COVID-19 pandemic has had a devastating impact in terms of health, economy, tourism, and more. The increase in the number of cases of infection has led the Malaysian government to announce the implementation of movement control orders. During the implementation of movement control order, the government failed to possess the good public management on standard operating procedures during the pandemic. As stated by Datuk Sri Ismail Sabri, who is the Minister of National Security during that time, he said that failure to observe physical distancing contributes to the rise case of COVID-19. This is evidence that bad public management will lead to bad consequences. Failure can be seen as a typical part of government operation in the literature of public management. Goodsell 2000 and Hull 2002 conducted a research on the failure by bureaucrats that lead to the shaming by citizens. These accusations usually mix up two types of failure, which are failing to give what citizens desire as customers and failing to provide service according to predetermined criteria. Therefore, what is the reason for the failure of the standard operating procedure issued by the Malaysian government? As a researcher, it is important to identify the factors contributing towards good public management on standard operating procedures during the pandemic of COVID-19 in order to improve the efficiency and effectiveness of public management.
There are three research questions in this study, which is the first one is what is the relation between the social well-being of society and good public management on standard operating procedures during COVID-19 in Klang, Selangor. And the second one is what is the relation between social environment and good public management on standard operating procedures during the COVID-19 in Klang, Selangor also. And the third one is what is the relation between the good governance and good public management on standard operating procedures during the COVID-19 in Klang, Selangor. They also have three research objectives, which is the first one is to identify the relationship between social well-being of society and good public management on standard operating procedures during the pandemic of COVID-19 in Klang, Selangor. And the second one is to identify the relationship between the social environment and good public management on standard operating procedures during the pandemic of COVID-19 in Klang, Selangor. And the last objective is to identify the relationship between the good governance and good public management on standard operating procedures during the pandemic of COVID-19 in Klang, Selangor.
Next is conceptual framework for this study. The first one is social well-being of society. According to paper 2017, social well-being is the ability to participate, feel value as a member, and feel connected to a wider social environment. Next is social environment. Morkel 2012 stated that social environment or complexity theory provide process and concepts for handling the macro or micro issues of society at the heart of the policy making process. Social environment in the study focus on the elements of consideration, where consideration is one of the important elements in leadership behavior which is being considerate to other people. The next one is good governance. Giselle Quiz 2012 defined governance as the process which public institutions conduct public affairs and manage public resources for social and economic development. According to Al-Kuti 2020, a good governance must have accountability and standard compliance. Accountability refers to the process by which public entities and their employees are held accountable for their decisions and actions. Based on the conceptual framework, the hypotheses being developed, there were two hypotheses for each independent variable, which are H null and H alternate. For H null, there is no significant relationship between social well-being of society and good public management on standard operating procedure during the pandemic of COVID-19. For H alternate, there is a significant relationship between social well-being of society and good public management on standard operating procedure during the pandemic of COVID-19. The same hypothesis been developed for the remaining two of independent variables, which is social environment and good governance, where there is no significant relationship for H null and there is a significant relationship for H alternate. Next is research methodology. For research design, the study uses cross-sectional design by using quantitative method. The study relies on quantitative method that focus on primary data from a survey that involve respondents in the Ulu Klang area. The researchers chose cross-sectional because it can be tested on multiple variables, inexpensive, and takes a short of time. Next, the unit of analysis for the study is the individual, which refers to the individual of 5 selected residentials in Ulu Klang, Selangor. Furthermore, the sample used for the study is 379 respondents among 5 selected residentials in Ulu Klang, Selangor. According to the city population 2020, the overall population of the 5 selected residentials area in Ulu Klang, Selangor is 26,467 people. The researchers cite the table provided by Kretzi and Morgan 1970 to determine the sample size. Other than that, the sampling technique used in the study is stratified random sampling. The researchers chose stratified random sampling because it is most efficient among other techniques. In the study, the researchers divided the population into 5 residentials area. Next, the data measurement used is a Likert scale. It is a measurement scale that uses 5 points that represent respondents' satisfaction scale for every question. Next is data collection. The study provided a set of questions to collect data from the respondents. The study questionnaire produced in a dual language format, which is English and Malay, and the questions asked about the respondents' knowledge and their experience for each variable. There were 5 sections covered. Section A is respondents' information, Section B is good public management on standard operating procedure, Section C is social well-being of society, Section D is social environment, and Section E is good governance. Lastly is data analysis. The study used descriptive statistics and person correlation. Descriptive statistics used to find mean and standard deviation for each variable, while person correlation used to investigate a relationship between independent variables and dependent variable. The value of person correlation will determine the degree of relationship, whether there were positive or negative relation, and hypotheses will be decided according to the value.
So based on the table, it shows the demographic profile, and the frequency of male is 171 and the frequency for females is 208. Thus the percentage of male is 45.1% and females is 54.9%. Therefore, the total respondents are greater than females. Next, most of the respondent age are between 21 to 30 years old, which is 41.4%, and followed by the 30 until 40 years old, which is accounted 38.5%, and 40 to 50 years old accounted 18.2%, and the least are 51 until 60 years old, which is only 1.8%. Furthermore, most of our respondents, which are 149 respondents, came from public sector, which is 39.3%, and there are 143 respondents from the private sector, which is 37.7%. 87 respondents were none of the means that respondents were not from the both sector, public nor private. In addition, for the employment status, there were 239 respondents, which is 63.1%, were in the full-time employment, which is more than other status of employment. There were 49 respondents part-time employment, and 4 respondents were retired, and 83 respondents were students in this study. And 4 respondents were unemployed. Lastly, there were 5 locations of residential that we focus on this study. Location that has most respondent come from is Bukit Antarabangsa, which is 100 respondent, that 26.4%, followed by Taman Melawati with 89 respondent, which accounted to 23.5%, and UK Bestari with 71 respondent, which is only for 18.7%, and UK Perdana with 60 responded, which is 15.8%, and the list were Pandai Indah that only with 59 respondent that accounted 15.6% only. There are 3 main findings in this study where to find whether there is a significant relationship between the independent variables and dependent variable. Firstly, there is a significant relationship between social well-being of society and good public management on standard operating procedures because the R value is 0.762 and the P value is 0.00. Therefore, the alternative hypothesis 1 is accepted. Secondly, there is also a significant relationship between social environment and good public management on standard operating procedures because the R value is 0.793 and the P value is also 0.00. By that, the alternative hypothesis 2 is also accepted. Thirdly, there is also a significant relationship between good governance and good public management on standard operating procedures because the R value is 0.905 and P value also 0.00. So the alternative hypothesis 3 also accepted in this study. All hypotheses are accepted in this study because the R value is more than 0.
Next is research recommendations. The first one is improving public communications. Communication should be among the first lines of action for public institutions at all levels. Public communications should provide citizens with truthful and accurate information, educate citizens about consuming and sharing content responsibly, and engage citizens in a collective response to the information. Next is applying community-based monitoring. Community-based monitoring is a social practice where communities collaborate to monitor, track, and respond to specific concerns, especially environmental monitoring. To ensure the effectiveness of this tool for community-based monitoring, collaboration between researchers and communities to improve the method for data collection is recommended. Lastly is making communication participatory. Responding to the infodemic requires a whole of society effort to sustain a healthy information ecosystem. The government can allow a public communication for a two-way dialogue with citizens that will respond more directly, and this will offer governments a better insight towards public management.
There are 2 limitations in the study, which is the first one is the data collection process. Data collection process are significant because the technique and analytical approach used by the researcher influence how the data is used and what conclusion it can generate. In the data collection process, also the researchers need to distribute the survey that people staying in Bukit Antarabangsa, Taman Melawati, UK Bestari, UK Perdana, and also in Pandan Indah. They release the questionnaire on social media and it hopes that it will reach a large number of people. Second limitation is the insufficient sample size. In order to draw accurate findings from a study, it is critical to have a significant sample size. Your result will be more exact if you use a bigger sample size. The sample size in this study is insufficient because it does not include all of the people who live in Ulu Klang, but only those who live in specifically location. As a conclusion, this research to study and gain better understanding on the factors that contributed to good public management during this pandemic, which is a social well-being of society, social environment, and good governance. In this study, 3 most viewed factors contributed to good public management during the pandemic has been identified and studied for. Particularly, this study has given evidence that all independent variables which consist social well-being of society, social government, and good governance is significantly positively related with good public management during the pandemic. From me and Izzul Hakim for this research regarding the factors that contributed towards the good management and standard operating procedures during the pandemic of COVID-19 in Ulu Klang, Selangor. Thank you so much for listening and have a nice day ahead. Assalamualaikum.
Thank you and Assalamualaikum.